Perfect. Hey guys, so I want to go over a couple different ways that we can adjust patients. We're seeing a lot of patients with neck pain, upper back pain, and obviously when we adjust them, there's multiple different ways we can do it, whatever's going to be most comfortable for the patient, and so that they're the most relaxed. So the first one here is going to be face down. So all accomplishing the same goal. Like I said, it's more so just to make sure that our patients are comfortable as they're getting adjusted. Just a little bit. Perfect. So that would be face down. The next way we can do it is with the patient actually sitting up. Just to show you what that would look like. Good. Nice easy bend in the neck. Perfect. And then one more way is going to be face up. This is more typical that you may see a lot of chiropractors do. Again, it's just about the patient being able to relax and be comfortable while we're getting them improved. Good. One more. Perfect. And then the last way we can do it, and this is probably the most gentle that some patients do like, is what's called the activator. So all this is, again, it accomplishes the same thing we do with our hands, but we're just going to place that on the neck. And it just clicks and it makes the adjustment for us. Very precise, very light. Some patients do like this, but we like having multiple options when our patients come in, just again, so we can make sure that they're comfortable and they get the results that they deserve to get. Hey guys, next thing we're gonna go over here is cervical traction. So we do this with a lot of our patients that have neck pain or upper back pain, and there's a lot of different reasons we can do this. The main one is we wanna really help restore that curve in the neck. So if we have patients that come in here where the head's forward in front of the shoulders, shoulders round out, we want to start to teach them to get those shoulders back and get the head back so that the ears are lining up straight with the shoulders. Okay, so the reason that's so important, if we look at the neck from the side here, you should have a smooth 45-degree curve in there. So you can see if the curves in the neck, this rubber band represents all the muscles, ligaments, tendons, everything's nice and relaxed. As we start to lose that curve in the neck, you can see how tight things get. And that's where those patients usually just say, man, if someone would just rub my shoulders, I would feel so much better. That's why it's so important to restore that curve to get all those muscles to relax. So let's show you how we set somebody up on that. So I'm gonna have Liz lay right here, face up. And then all we're gonna do is start to line this up right in the center of our spine, and then go ahead and drop the head back, Liz. We want this set up so that there's no gap between the shoulders and this here. So her head's gonna fold back over it. We're gonna usually start everyone out with about 3 minutes, and all the patient has to do is lay there, nice and relaxed, try to stay calm. Once that timer goes off, we're gonna have the patient roll off to the side and sit up, and we're gonna keep building up each time the patient says this feels okay. So the goal is to get to about 10 or 12 minutes with this.
With the mid back here, so you're gonna flip your wrist up towards the ceiling. Same thing, open up that chest, drive those shoulder blades down and back, pull out to the side, hold for 1, 2, and then relax back up. So squeeze right down here, and then come down center, step up there a little more, good. Pull back, back center, and then 1 more, relax back up. All right, so what we're gonna do is we're gonna focus on that upper back right here. So go ahead, you're gonna open up the chest, round the shoulders back, pull the arms out to the side, hold for 1, 2, go ahead, squeeze right there, and then come back center. Go ahead, pull out to the side, pull a little further back, and then squeeze right here. Back center, let's do it one more time. Next one we're gonna do is we're gonna work more the upper back traps and the rear delts. So starting position here, same thing, drive the shoulders down and back. We're gonna go a little bit outside of the ears and then back down to this position. Good, squeeze here, relax back down. Perfect, let's do one more. Perfect. Go ahead and you're gonna drive the chin to the chest, keeping your head flat on the table, and then lift your head off the table for 1, 2, and then relax back down, and then reset by looking back up towards the ceiling. Good, go ahead again, drive that chin to the chest, up, back down, looking back up, and we'll do one more time. Perfect. So arms are gonna be out in front, same thing, open up the chest, draw the shoulders back. You're gonna just drive your arms back here, leaving the elbows a little bit higher, and then squeeze up here and then back here. And then go ahead and just straighten your arms back forward. Go ahead, pull back. Don't go back too far, stop about here, you gotta squeeze here. Hand over your belts, go ahead back forward. And do it one last time. Good. Keep your arms down at your side, open up your chest. You're gonna go as high as you can without pain or discomfort, opening up your chest and your shoulders. Yep, that was a perfect one. And then go ahead and go all the way back down. Go ahead and do it again. Do you have any pain or discomfort with this? No, super. And then we'll do it one more time. This movement, arms out in front. You're going to round the shoulders back, drop the shoulder blades down, drive the arms down and back, bring the elbows a little closer, focus on squeezing the lats. Now go straight up into that Y, and then go ahead, bring your arms back down in front. Good, let's do it again. Drive the arms back, focus on those lats, up into that Y, in front. One last time, bring the arms back into that W. Good. Out in front, and then back down. All right, guys, I am here with Liz, who is our nurse practitioner.
Hi, y'all.
And Stephanie, who is one of our rehab techs.
Hi.
Today what we're gonna do is show you our medical side of things. So we have non-steroid based injections. Today we're gonna talk about trigger point injections. So trigger point injections are gonna help with any type of knots, trigger points, adhesions. You know, when you press down on your traps, maybe your mid-back or your low back, and you do feel those knots, trigger points, and adhesions, that's built up scar tissue. So the trigger point injections, Liz is gonna go into a lot more detail with that. That's gonna help break up those knots and trigger points to decrease pain and increase range of motion. So she's gonna show you on Stephanie.
Like Danielle said, these are trigger point injections. It is an acupuncture sized needle that goes into that muscle and breaks up that tightness and that stiffness. Most patients think that these are pain injections, which that is partially true, but the whole goal is to ease that tightness and that stiffness, and once we do that, in return, that's going to help with range of motion, it's going to help with pain. So I'm going to demonstrate this, how I do this on Stephanie here. First thing that I do is I am actually going to press on the muscle here, because the first part is actually feeling that tightness to make sure that I'm actually hitting the muscle, that tight muscle. So these can pretty much go in any muscle. Most common areas are the neck and the low back. So I take the end of this needle here and I'm gonna just kind of make that mark so I know right where I need to go with the injection. Next, I'm gonna clean it with an alcohol wipe here. And for some patients who don't like to actually feel the needle, I'm going to use a ethyl chloride numbing spray. So I'm gonna do that right now, right over that dot. And as you see that turn white, that's how I know that I sprayed enough. It does penetrate deep into the tissue, and it's really not gonna, it's gonna help the patient not really feel that poke. Next thing that I'm gonna do is I'm going to, this is now lidocaine. It's a numbing agent that's gonna go in and relax the muscle. So I'm just gonna do a little poke right here in that center of that dot. I'm gonna tell Stephanie to go ahead and take a deep breath. Inject about 1 cc into the muscle, and then we're done. Stephanie, go ahead and kind of shrug your shoulder here. Kind of work that medication into the muscle there. There might be some redness and some soreness at the injection site, which is very common. So what you want to do if it is sore, there is no restrictions. You can go ahead, you can continue to work out that day, work at home at the computer, but just use some ice or heat to that area that was injected, and then give it about 24 to 48 hours for you to see less tight tightness and less stiffness. Hey guys, so I'm back here. We're going to demonstrate now a trigger point injection here on Stephanie. I'm going to kind of walk you through the steps of a trigger point injection. Again, a trigger point injection is similar to acupuncture sized needle. There's lidocaine, a numbing agent that goes in the needle to decrease and relax muscle tightness and tension and scar tissue within that muscle. So first thing that I'm going to do is I'm going to take my little end of the cap of the needle here, and I'm going to press on and find that tightness in the trap here. Once I find that tightness, I'm going to mark it. It's going to leave a little round circle there. That way I know exactly where I need to go in the muscle. Next thing that I'm going to do is I'm going to clean the skin with an alcohol wipe. Next thing that I'm going to do is I'm going to grab my ultrasound probe here. There's some gel already on the probe. And I'm going to shine it over here over the muscle to illuminate that over here on the screen. The muscle is coming right through the center of the screen here. And the reason I do the ultrasound is to make sure that the muscle is clear of any fluid, cysts that I should not be injecting into. Next thing that I'm going to do is I'm going to use a swab here and get the gel off. And then now it is ready for me to do a numbing spray that will help patients not really feel much of the needle. It's an ethyl chloride numbing spray. I'm going to spray that on the skin now. And do you see how it's turning white on the skin there? That lets me know that I've sprayed enough and it's going to penetrate deep into the tissue. It's going to make it where the patient doesn't really feel much of a needle. Now I'm all set and ready to get my needle here, and we're going to go right into the center of that mark, just about a ½ inch there. And then I'm going to inject 1 cc into the muscle. And then we're all set. Pull it right back out. Stephanie, go ahead and kind of shrug your shoulder. I have the patient kind of shrug the shoulder, kind of work it in the muscle. Just like with any injection, there may be some redness and some soreness at the injection site. With that soreness, if the patients do feel that, later on in the day, they can use some heat or ice to the area. There is no restrictions with activity. They can go work out later on. If they have some work they have to do at the computer later on that evening, they can go ahead and do that as well. Give it about 24 to 40 hours for that muscle to become less tight, less stiff.